back to school often means back to germs. So we have Dr. Michael Kilkenny and Assistant Director of Nursing Harley Walden in from the Cabell-Huntington Health Department to help us all out. Great to see you
Yeah,
all.
thanks for both of you to be here. I know some schools already started last week, some schools started this week. What are you guys seeing trending with that back to school bugs?
Sure. So we're entering a respiratory disease season, and that's flu, COVID, and RSV. And typically those are seen in small numbers in the summertime because we're outside hiking, biking, in free-flowing air, open spaces.
Right.
But as we switch and transition into peak respiratory disease season, fall and winter, we gather together, close quarters, rebreathing in circulated air. But we all realize the importance of fellowship with our friends, family, and loved ones at that time of year, and that's very valuable. And the good news is that there are very good, easy ways that we can combat these respiratory diseases.
Oh, good. So what can we do? Because, I mean, we're looking at your footage of kids sneezing and with runny noses. They do tend to get this, and then they bring it home and share it with us.
Yes,
that's so thoughtful.
Nice.
So what could we be doing better and to prevent the spread of these diseases?
And one of the things that we can do is wash our hands, and wash our hands and wash our hands some more.
Okay.
The other things we can do is cough etiquette. Make sure you cough into some cloth,
yes,
your elbow,
yeah.
or a tissue or something like that to prevent that. And we sometimes have to disinfect surfaces and objects, especially when you're dealing with kids and they have toys and they put them in their mouths and then they share them. Those have to be frequently disinfected during respiratory season.
And those are great reminders.
It is, because it's almost like, you know, those things were reminding us during COVID and the pandemic so often, and then it's kind of like it's not right there in your face.
We kind of slacked off a little bit, I think, in general.
Yeah, and the good news is that a lot of these are vaccine preventable diseases, and the Cabell-Huntington Health Department, Monday through Friday, 8 to 3 by appointment, you can come in and we'll address all your vaccine needs. And this coming up Monday, 3 to 6, we're offering an extended hours clinic. No appointment needed, walk-ins welcome. We have all the vaccines birth through age 18. We'd be happy to see you and come on down.
Oh, that's great.
And I think those after-school areas or time frames really help for parents.
Yeah,
it really is. And if we happen to get sick, how do you all help during outbreaks? Because we all know several years ago, COVID, we were all dealing with that. With some of these other viruses that are going around right now, if there would happen to be a lot of people getting it, how does the health department step in and help?
We do surveillance all the time. So we have surveillance on respiratory illnesses year-round.
Okay.
We watch that, and then we share that out with some of our strategic partners, like the schools and our healthcare partners, so we keep them appraised of that. In addition, we'll do some pre-outbreak work with folks. This summer we had a special program where we had a couple of our staff members who could go out to daycares, nursing homes, and talk to people about infection prevention and outbreak control, and train them ahead of time, because when the outbreak does occur, we will be made aware of it. We will step in. We'll be contacting patients or their parents, and we'll be informing the staff of what they need to do. Our goal is to keep the kids safe and to keep those vital services open, and so we're going to do the best we can at all times, but in respiratory season that's always challenging.
It's a tough one right now.
And remind everyone where they can see the information about the vaccine clinics if they didn't catch it today.
Yeah.
Sure. We're very active on our socials, Facebook and Instagram. We have an active list of our community outreach events, and that should be posted on there.
That is great. Well, Dr. Kilkenny and Harley, thanks so much for coming in. And you heard them say, wash your hands, and keep washing your hands, right?
Thank you for being here.
Thanks for having us.